The department has introduced potentially major changes to immigration health policies, which should make it easier for permanent and provisional residence visa applicants with a long-term health condition or permanent disability to meet health criteria and therefore to qualify for visa grant to Australia. In this video, we will take a look at what these changes are. Hi, I'm Booky and you're watching the Youenrol channel. On this channel, we provide you with all the information you need about studying, living and working in Australia without you having to pay costly consultant fees no matter where you are in the world. Before we begin, don't forget, like and subscribe to this channel. Also, do click the bell icon so that you don't miss out on our new videos when they're released. Now let's talk about these changes. The changes which came into effect on the 1st of July 2019 are two. Firstly, in assessing whether a visa applicant meets the health requirement, a medical officer of the Commonwealth, which is also a registered medical practitioner appointed by the department, is required to provide an option as to whether an applicant's medical condition or disease is likely to result in significant health care and community service costs if the visa were to be granted to the applicant. Under the immigration policy, before these changes were implemented, the maximum cost threshold, as it is referred to in the policy, was $40,000 from the 1st of July. From 1st of July 2019, this threshold has been increased from $40,000 to $49,000, which is a rise of 22.5%. In the second and more significant change introduced, an applicant for a permanent or provisional visa who has a permanent medical condition such as hepatitis or kidney disease will only be assessed on their likely health care and community service costs over the next 10 years and not over their lifetime, which has been the case before this change was implemented. This shorter assessment period will likely improve the chances of affected visa applicants meeting the health requirement for visa grants, especially for applicants who are relatively young and healthy. This also means that they even no longer need to lodge a health waiver as part of their visa application. So, what is a health waiver? Applicants who would otherwise fail to satisfy the health criteria can, in some circumstances, apply to the minister to waive this requirement if they meet all other criteria for the grant of that visa and the minister is satisfied that granting the visa would be unlikely to result in undue cost to the Australian community or undue prejudice to the access of healthcare or community services of an Australian citizen or permanent resident. Be aware that for some visas, the health requirement does not include a provision for it to be waived. In such cases, the visa applicant will be unable to be given the visa if they do not satisfy the health criteria. So what about the temporary visa applicants? For temporary visa applicants, the assessment period for their likely health care and community service costs remains the same, which under the current policy is the period over which the temporary visa is to be granted to the applicant. To illustrate how this provision is applied in practice, take the example of an applicant whose estimated annual health care costs are $20,000. If they apply for a temporary skills shortage TSS subclass 482 visa with a term of 2 years, they will meet the significant cost threshold and therefore meet the health requirements for visa grant. If, however, the applicant is to be granted a 4-year subclass 482 visa, they would exceed the cost of significance threshold with total estimated cost of $80,000 and they will be unable to qualify for the visa unless they successfully apply to the minister to have the health requirements waived. This brings us to the end of this video on the recent significant changes to the Australian migration health policy. Don't forget to like this video and subscribe to the channel. Also, click the bell icon to find out when the new videos are released. Thanks for watching and see you in the next video.